I'm Josephine Dolan, and I'm professor of nursing at the University of Connecticut. My main responsibility there is teaching the historical foundations of nursing. I am very lucky to have students in our own school and many students in other colleges elect the course, for which I am very happy. I will try very hard to make this course live and become alive for you, and I would ask you to cooperate with me. Let me tell you how this course is going to develop. We can only understand the progress of nursing if we understand the progress and history of mankind through the years, so that this will be divided up into historical aspects of time. And today we start with a consideration of primitive areas. Now, actually, the history of nursing, from my point of view, should really be referred to as nursing anthropology, because it really is a study of human beings in health and sickness. You know, a famous doctor has said, such a study should concern itself not only with man as a biological entity, but also as a social and historical entity related to other things in time and space. Well, this course in Nursing in Society will concern itself with the cultural, social, economic, and religious factors that have promoted nursing as a field of human service. Now, what about you? What's your role at this time? Well, you know that a uniqueness in man lies in his ability to remember the past, to analyze, to explain past events, and most of all, to draw meaning from these events. Therefore, it's imperative for both of us to learn from the past, to be guided by its lessons, in order to have a future fruitful growth. Abraham Lincoln said this as well as anybody I've ever heard. He said, if you don't know where you've been, you don't know where you're going. All right, let us start then. Let's observe the sick in a primitive setting. The scene is timeless. It could be as old as the very first family, or it could be as current as this very day in some remote part of the world, or in this particular part of our country, in our own midst, right this moment, today. If I asked you to define the word primitive, I would realize that we'd have many, many definitions. The word poses a problem of semantics, and we really need to interpret it. A definition always differs according to one's environment, one's educational background, one's experiences, one's personal standards. What you would consider primitive and what somebody in some isolated part of the world would call primitive could be enormously different. Actually, the word primitive comes from the word primus. And according to the dictionary, this is first, simple, rough, reduced to elemental. Primitive, then, would be the first or the earliest of its kind, or the earliest in existence, or that which is unaffected or little affected or unwilling to be affected by civilizing influences. Now, I want to remind you that the care of the sick in a modern primitive setting isn't necessarily the same as that of his prehistoric peoples. However, isolation from progress may very well present a similar frame of reference for us to use in judging the earliest and the most elementary methods of caring for the sick. We both know that from the very earliest times, the most crucial problem man has ever had to face is the basic problem of fight for survival, just to stay alive. And you know that we have many needs that we call the basic human needs of man, and the provision of these have varied and according to the different areas of the world. But let's just review them together. We need water, clean, non-contaminated. We need food for personal physical growth, enough of the right kind. We need clothing, suitable, non-injurious. We all need love. We need warmth. We need shelter from the elements. We all need human dignity. We need recreation or recreation, which really is an expansion of the spirit of man, and it involves emotional and spiritual values. There's a need for faith, for a religion. We need rest, relaxation, protection from the ravages of disease. Well, throughout human history, and I have to say even to this very day, we've had 6 major problems of community health. Let us go over them together. Being able to provide water and food of good quality and sufficient quantity is a prime problem. 2, controlling and improving the physical environment, and that involves sanitation and, of course, prevention of air pollution, is another problem. 3, being able to control transmissible diseases is a hard one. 4, providing medical care is a crucial problem. 5, being able to cope with perplexing medical problems. Just think, the problems of pain, bleeding, shock, infection. And 6, being able to relieve disability. My, that really is a tremendous list of very potent, dynamic problems. Well, how do the primitive peoples face these problems? The oldest medical records tell us that we had empirical medical practices. Actually, we refer to these as trial and error. They were based mostly on observation of animals. But you know, these courageous people found food, and they found food that provided them with as balanced a diet as possible, and this was instinctively. In addition, they knew that some food contained poisonous ingredients, and they had to learn how to remove the poisonous substances from the staple items in the diet. For instance, this lady, using manioc, which is an item in the diet that's used in many places around the world, knew that it was important for her to place it in some sort of sieve. This lady is using a wicker basket, and she is squeezing out the poisonous ingredient that comes out in droplets, as you can see. The droplets contain prussic acid or cyanide. Now, they had to use this as a food, so they had to get rid of the poison. Well, they also discovered very early in the game that certain foods, though harmless, produced vomiting and purging. So they then had emetics and purgatives. Shyrock has said, the man who first found a good emetic performed a real service to mankind. Could be. Now we have the beginnings of naturalistic medicine. We call it today folk medicine. And we have learned in our very sophisticated society a great deal about the medicines that have been used in this category of plant lore. The information was passed on from generation to generation. The knowledge became cumulative. Sometimes this knowledge has been surprisingly sound. Unfortunately, it has also been a way of perpetuating inaccurate information. The woman had a very important role in caring for the healthy, as well as caring for the sick. Very likely, the first mother was the first nurse, the first pharmacist, the first physical therapist. You know, Osler has made a very important comment. Listen to him.
Nursing as an art to be cultivated and a profession to be followed is modern. Nursing as a practice originated in the dim past, where some mother among the cave dwellers cooled the forehead of her sick child with water from the brook.
She cooled the forehead of her sick child. What was the role of the nurse in this period? Actually, her interest showed forth in the practical skills of mothering and nurturing her families, neighbors, anyone who needed her. Sympathy was expressed in service, and she showed forth the tenderness, the love, the hope, the concern, as this mother does, cradling the head of her child in her lap. The child is stretched on a straw mat in a very crude shelter, but is getting real, tender, loving care from a concerned mother. Many a primitive nurse really helped a person to live. This we know. Now, these people faced another very serious and baffling problem, and this was, what was the cause of sickness? If something happened, such as a snake bite, you know immediately that the symptoms that you saw came from the external cause, the snake. But when something baffling and bewildering occurred, such as sudden illness, this was terrifying and certainly needed an explanation. The empirical practices that we've mentioned now were combined and supplemented with occult practices. These really were those practices that were above the natural practices, or they were the supernatural practices. These resulted from critical thinking to find the cause of disturbance. Now, these people knew that violent storms, earthquakes, all of the unusual in nature, really they felt were caused by malevolent gods and demons and evil spirits. Now, they tried the technique of transference of learning over to the fact that couldn't evil spirits also be the cause of sudden illness? Would it not be possible when sickness struck with the suddenness of lightning that this could be caused by these evil spirits? And actually a word we use today started here, and that is the word stroke. He suffered a stroke. This suddenness, combined with the inability to associate the illness with any observable cause, was frightening. Actually, all of our patients from time immemorial have been concerned by the fear of unknown. Well, in a search for a solution, they came up with the idea of animism, which is that the air swarms with spirits that enter the body. Now, there were good spirits, and those were the ones that brought us blessings and joys, and there were bad spirits. Those were the ones that possessed our body and caused illness. And we also have an expression that we use that comes from a primitive area, and that is, what could have possessed him to cause him to do such a thing? Now, we knew that people had the ability to cast an evil eye over somebody or to put a hex on somebody, and this was called black magic or the evil eye influence. Well, they needed to think up ways of ridding the body of this evil spirit. They had to knock the devil or beat the devil out of the person. This required either submission, and there have been those people who have said, so, I'm sick, or sacrifice in order to placate the evil spirits, and sometimes the sacrifice involved human sacrifice, or supplication, which meant praying for help. The strategy of animism actually was the use of magical powers. Primitive peoples sought a means of protection, something that really we might consider was an early and probably unscientific form of preventive medicine. An amulet was one of the things that was devised at this time, and this is something that would ward off danger. Let me show you some amulets that we have here. The first one is from Guatemala, and it's called an Eye of God amulet. It actually was made by the medicine man for a brand new baby. It's a very beautiful thing, and it was woven by him. These are very unusual and beautiful shades of yarn that are worked in together for an Eye of God amulet, as it is referred to. Now this warded off the evil spirits from the newborn child. Another and very beautiful one, actually, is from Portuguese East Africa, and it's a necklace. The trader beads are the heavenly blue beads. Interspersed between the beads are little antlers or horns, and two of them, for instance, this one has the medicine still in it. There is a little bag of medicines here that will ward off illness. The whole amulet necklace is unusually beautiful, including these little, very delicate pieces of wood, very intricately carved. These are very light at weight and probably of the balsa wood variety. Now there were talismans, and these were those things that brought you good luck. And again, some of these were personalized, and one I'd like to show you is this particular one. This is made in the shape of a turtle. This side is made with very interesting beads in a particular pattern. On the back, there usually is an opening here, and when the umbilical cord came off or fell off a newborn baby, the mother carefully placed this within the innards of this little talisman, and then the person to whom the umbilical cord belonged carried that throughout life as a talisman to take good care of the particular person. Now, primitive medicine actually, I would say, comes about midway between magic and religion. Sometimes it is confused, sometimes they fuse. Gradually, the magic lore accumulated and became so complex that somebody had to be in charge of carrying out this particular function, and the medicine man or witch doctor emerged. Now, what was his role? Well, his therapy appealed to all the senses. He used a fear or scare technique or shock technique to rid the body of evil spirits. You realize how fear produces chemical changes within the body. We see fear techniques carried out today. This particular medicine man is doing his best in every way he can think of to have the evil spirit leave the person's body. False faces or masks became part of the thinking of the medicine man, and dreams suggested these masks, which were made by the Iroquois False Face Society, and they are carved of wood very carefully. They also carried rattles made of turtle shells. Now we have two false faces here, or masks, that were used. They are both made out of wood. They're really quite unusual and rather beautiful ones. I think they're fearsome, I have to be honest. The eyes are of metal. The carving is beautifully done. The hair is natural hair, and these did evoke fear within the person's body. This particular one is from Guatemala. The color is quite unusual, as you can see. The antlers are from animals. There are holes for the eyes, and it certainly terrified an evil spirit, or I would assume so. I have to remind you that these people were not the only ones that used the scare technique, and may I say, what do you do when your friends have hiccups? Well, the medicine man tried to use everything that the person saw or smelled or tasted. This was supposed to be obnoxious and caused the evil spirit to leave the body. This particular man is medicine man is using a rattle, which he's shaking. He's causing a tremendous amount of noise. You know that the body is such a nice, comfortable place. Of course the evil spirit is reluctant to leave the body. And then gradually there came a time when the only thing that was left to try was to bore a hole in the skull of a person as to provide an exit for the evil spirit. This is a trepanation operation, and the medicine man used a stone to bore a hole in the skull of this particular person. I would like to show you what a skull looks like when such a trepanation operation has been performed. This particular gentleman had a hole bored in his skull, and you can actually see the reconstruction that has taken place. Now, I would assume that the gentleman probably survived this operation. I have seen one in which 5 such holes were bored in a skull, so that the person at least survived 4 of the operations. Now, there are certain treatments that are rather unusual, and to prevent bleeding and to encourage healing, splinters of wood were placed in a person's skin to draw the skin together. You are seeing such a performance at the moment, and to the patient's left you see a carved figurine. Hopefully the evil spirits will enter that particular figurine. Something else, insects, and ants in particular, after they die, they cling tenaciously, and so these were used as clips would be today. Now, would you notice to the right of this particular patient, there are little carved figurines into which the evil spirits will travel. Now, I think you should realize that, again, people began to think, well, evil spirits didn't like to leave the body. On occasion, babies didn't like to leave the body when a mother's term was up and the period of delivery was at hand. And as a matter of fact, sometimes the technique was to try and scare the baby out of the lady's body. I'll just give you several examples. For instance, on occasion, she had to spread her legs widely apart, and a fire was built under her, and supposedly this was enough to make the baby come forth, and the delivery process occurred. Something else, on occasion she was strapped to a tree, and a horse would gallop at high speed toward her, and just before he reached her, he would veer off, and supposedly this helped. I'm sorry to say they didn't stop to think, was the mother's pelvis anatomically large enough to accommodate the baby and to permit for a normal delivery? I think you might be interested in seeing a Zuni custom of delivery. In this particular instance, as you look at this picture, you see 2 scooped out areas in the sand. The little one is for the baby at the lower left of your screen, and on each side you see corn cobs, which are symbols of fertility. This actually is an excellent example of an early rooming in period. The baby on the bed is having yucca roots rubbed over the baby. You know, I have to, again, ask you to remember that 200 out of 1,000 live births, 200 of these babies died. Now, what about culturally approved mutilations? Well, you know that many people have used binding the head and feet of children, and in many parts of the world, when a baby is quite small, they start and twine around the baby's head until the baby's head is elongated, as you can see the result of this treatment here. Sometimes they put things in a person's ear, and you can see how these heavy wires are placed all the way, embroidered really, through this person's ear. Sometimes a very delicate tissue of the earlobes were bound down by these heavy wires. Now, they also deformed the lips, and I think that this will interest you to see this lady's lips with these film cases in them. Can you imagine what that must be like to carry those around? I often wondered how they eat. Well, I wondered about a lot of things, as you do too. Maybe you'd like to see how water is given to such a person with this particular type of plug in the lip. There you see it. Let me show you what this looks like. See the size of this. Can you imagine carrying something like that around in the lower lip? And we hear so much about damage to delicate tissue. Now, they also implanted dirt and paint into the scarifications in the skin. Tattooing is an example of this. And this was paint that was injected into the skin by the use of needles. Now, you know that many large cities have closed tattooing parlors because of the danger of transmitting infections such as hepatitis through these needles. You know, there is a certain group who put carnelian, they embed carnelians into the teeth. And so when they smile, this wards off evil spirits and discourages evil spirits from entering the body. Now, that's really going to quite an extreme length for protection. Now, you think of the many practices our culture participates in that would be very difficult to explain to others. We use contact lenses, and we have all kinds of plastic surgery to make our bodies more svelte-like. And you know, even some people have their bones shortened in order not to be so tall. You think of all of the things we do. Consider, too, some of the superstitious practices that have become important in our life and in primitive peoples. You know, many public health nurses have removed sharp implements from under a person's bed. The person has placed it to cut the evil spirits. Think with me of some of our superstitious practices. Think of the people who walk out into the street facing the onrush of traffic rather than walk under a ladder. And think of what people do when they see black cats and when mirrors break. And do you keep your fingers crossed when you're waiting to get your test grades back or when you're hoping that the phone will ring? I think the thing that reaches me is how many of our palatial hotels and the very newest hospitals don't even have a 13th floor. We go from the 12th to the 14th. What does this say about us emotionally? You know, Robinson has said, intellectually, we're but a stone's throw from the Stone Age, and emotionally, we're still there. You just think about that just a little bit. Lastly, what do we have to learn from people whose cultural backgrounds might be considered primitive when compared to ours? Or what do we have to learn from the medicine man of such a community? I think it might interest you to know that medical science, in search of life-prolonging drugs, are begging some of the medicine men to share their secrets with us. And I think we have a lot to learn from them, and we must pay attention because they have many answers.